Doctor, so today we are going to be talking to you about equine gastric ulcer syndrome, especially in performance horses.
Yeah.
So the first question we have, and we're going to jump right in, is the research shows that 80% of thoroughbred horses develop gastric ulcers within 2-3 months of training. And in endurance horses, it shows that 48% prevalence during off-season, which jumps to 93% during competition. So it's not an uncommon thing. It's a very common thing. So what makes these performance horses, what causes these performance horses so quickly to become vulnerable to EGUS?
See, the thing is that if we understand the equine stomach,
Uh-huh.
equine gastric ulcers can affect at any stage of the horse. He's a performance horse, he's a race horse, he's an endurance horse, as well as non-performance and foals we have seen as early as 7 days with ulcers. When we scoped them, we found the ulcers. So we have to understand that this is a natural environment of the equine stomach with the acid. And what is ulceration? Is the erosion of the stomach lining due to the prolonged exposure to the natural acid in the stomach.
Right.
So, horse's stomach manufactures and secretes hydrochloric acid, creating a natural acidic environment.
Mm-hmm.
So, the pH of the stomach keeps on fluctuating. It depends upon the gastric contents, it
Mm-hmm.
depends upon the amount and what food they are eating and to
Mm-hmm.
which type of stress they are being exposed to
Right.
besides the sport. And the acidic environment, like in the pH of the stomach, ranges from as low as 2 and it can go up greater than 6 as well. So, even in the best circumstances, the stomach is acidic.
Mm.
So, now basically, the gastric ulcers, if we look into it, it's a man made anomaly.
Oh.
See, in the past, when the horse was not in the captivity so much, they had their own strategy of eating, own strategy of management of their well-being.
Right.
So coming to the point, causes of gastric ulcers are often man-made and
Mm-hmm.
include like in our environment, like in our equestrian sports. When we see into the factors, yeah, we come across them very often, like stall confinement, prolonged period of time without feed, high grain diet, we want them performing. And what high grain diet does is they produce volatile fatty acids, and then that contributes to the
Mm.
initiation of development of ulcer. Then you have stress, environmental stress, and
Mm.
physical. Like
Mm.
they cannot in summer they cannot go out,
Mm.
and in the like when they in the cooler part of the times of the day, that's morning and evening, even if we send them outside, we need to
Mm.
monitor that for how long. So these are the contributing factors. Changes in the environment,
Mm.
changes in the physical, like for example, which transported the horse from one stable to other. So
Mm.
there is change of surrounding. These
Mm.
are the stress contributing factors. And
Mm.
then, we have every equine athlete
Mm.
goes through musculoskeletal problems. It's a part, even if the human athletes or the animal.
Mm.
So we give them non-steroidal anti-inflammatory drugs, like something which helps them with the musculoskeletal problems. They
Mhm.
from these drugs they do the equine ulceration also. They
Mhm.
cause ulcers in the stomach. That's that will be the different topic to speak about. But now I'll tell you the factors. Causes of gastric ulcers, I told you, stall confinement, prolonged period of time exposure, high grain diet, stress, and then chronic medications. Like if you have some horse on the medication, we are not monitoring or management this illness, there will be surely an ulceration.
Right.
And then, which is the neglected part, are the signs of boredom. Like, he's a companion animal.
Mm.
We need to, he has to be companion with us. This is a
Mm.
horsemanship. Like, a horse is in the stall. If he has no toys, no hay balls, nothing to do, what he will
Mm.
be? He'll be in the street. He will be affected by the boredom, like pawing, chiving, walking on the stall, weaving, nodding
Mm.
the head. These
Mhm.
are all the contributing factors for his distress.
Mm.
We need to give the horse a comfort zone as much as we can
Mm.
because we are keeping the horse for the sport, for
Mm.
a leisure purpose, for the
Mm.
well-being, or it
Mm.
will be a farmhouse.
Mm.
horse. But at the end of the day, problem is same. We need to take him out from these factors. And what
Mm.
he is eating, like in UAE, we have the world best feed stuffs. Like
Mm.
the cool season grass we usually you have seen in every stable. This is the Timothy hay.
Mm.
So owner, rider, farm manager, or stable manager has to understand that nutrition plays a pivotal role
Mm.
in gastric disease in the horses.
Right.
If we come to the thumb rule, 75% of the horse's diet should be forage.
Okay.
That means that if it is a 1,000 pound horse, he should get at least 15 to 19 pounds of hay daily.
Mm.
How the hay should be given, steamed hay, how it should be, is it when we get the compressed hay bales in
Yeah.
UAE, we
Yeah.
get them open, we steam it or we sprinkle the water, then we use the hay nets and we tie it, or
Yeah.
we put it on the floor in the creepers.
Yeah.
So the concept is the horse will be masticating it.
Mm.
Once it takes masticate, it will produce saliva. Saliva will go inside and it will buffer the acid.
Right.
Second, prolonged feeding because it will take him time.
Mm-hmm.
Third, it develops intelligence in the horse. He keeps himself busy instead
Mm.
of going to the vices that are the bad habits. We call them vices in the horses.
Ah, okay.
So it is a multidisciplinary approach.
Right. So you would consider feeding also a kind of entertainment for the horse. Keeps the mind busy.
There are different school of thoughts. Some people say that feeding or the ground comes from the nature. I am with it, okay. Then
Okay.
you need to hang on the other corner with the hay net. Then you should
Right.
have a hay ball also. So the choice and the feeding regime will play a crucial role in the management of this syndrome, equine
Mm-hmm.
gastric ulcer syndrome, because we
Mm.
need to keep him away from the factors. If we don't take him away from
Mm.
the factors, the treatment alone is not going to do it. It's treatment plus management.
Mm.
Because I
Right.
told you this is a man-made thing.
Yes.
This is a man-made. The sequel is ulceration then. Because man-made factors, then you will get an ulceration. It's like that.
Right.
That's why I told you, even the normal horses, even the foals will have it. Why we see it in the race horses more? Because you are more monitoring them.
Mm.
We are provoking them with the more stress.
Right.
They are being induced to more stress, more workout, more performance. That's why we are telling
Mm.
it's with them only. It's
Mm.
like that.
Now, the European College of Internal Medicine distinguishes between ESGD and EGGD, glandular disease as well as squamous disease. There are two sort of branches. Could you explain a little bit about the distinction between these two treatment? Do we see it here in the Middle East as a common thing? Um, uh, could you talk a little bit, elaborate a little bit on this subject?
Yeah, see, equine gastric ulcer syndrome is an umbrella term
Ah,
for erosional ulceration of equine stomach.
right.
Then we have two branches. One is equine squamous gastric disease and one is equine glandular.
Mm-hmm.
In performance, we see performance horses as low as 10 and as high as 90% is more prevalence with the equine squamous gastric disease.
Fine. Okay.
While prevalence and the risk factors for equine glandular gastric disease is less well understood. I'll come to it
Mm,
one by one. This equine squamous gastric disease develops due to the exposure of the acid. Now we know it. And the
correct.
factors are diet, exercise,
Mhm.
and the feeding program, along with the treatment protocols that are already being run at the place of the equestrian facility.
True.
So this is like for example, I'll give you an example like you need to ride the horse around 10 a.m. Okay,
Mhm.
horse finishes feeding around 7:38.
Mm,
He finishes feeding. Now he's standing idle in the box.
right.
So if he goes out like this, there's this empty stomach with the acid, and you let him jump or you let him do the normal training program, there will
Mm.
be acid splashes, and the squamous mucus of the stomach does not have a protective mechanism for it. So
Ah,
it will cause the ulceration. So what
right.
we suggest for the owners, riders, stable managers, they should give at least hay should be a continuous program.
Mm, mm,
Okay,
mm.
we are not touching about the point that we have a hay belly. We don't want too much belly in the horse. That's a different program that can be managed. There are different factors where we are trying to put we call it the hay mat. The
Mm,
horse will eat he will eat the grass. He's eating the hay.
mm,
And rider book the horse to be ready in next 10, 15, 20 minutes. It's fine.
mm,
There is
mm,
already a hay mat on his stomach that will
mm.
not allow the splash. The acid has to be utilized by the gastric contents. If you
Right.
don't let the acid to do anything, it can cause the deterioration. That is the
Makes
ulceration.
makes
So that's
sense.
why hay mat is preferred. That means there should be some food like hay, not
Yeah.
grain. Grain will increase the acid. We
Right.
want hay. Hay
Yeah.
is friendly to the stomach.
Right.
Now coming to the equine glandular gastric disease, which you say that
Mm-hmm.
there has been little information about it. The development of this glandular ulceration is poorly understood.
Mm,
Since this area is already normally exposed to the high acidic contents,
mm-hmm.
but to see this, what is the reason causing is certainly a safety mechanism has been breached. That's
Okay.
why the factors that contribute to the loss of the protective mechanism, which is
Mm-hmm.
already having acid all time in it, has to
Mm-hmm.
be determined more, has to
Right.
be researched more. But the
Okay.
concept is coming, the links are coming that this is the breakage of the mechanism, protective layer, that's making it more prolonged to the loss of mechanism, which protects it from the ulceration.
Right.
Although this
Mm,
part is already in the acid every time.
mm,
So we have seen the horses with both equine
mm.
squamous gastric disease as well as the equine glandular gastric disease. And
Right.
the treatment protocols vary.
Mm-hmm.
Treatment protocols vary in both the cases. And
Right.
also, when we talk about the non-steroidal anti-inflammatory drugs, like usually the clonazepam, phenylbutazone, very common drugs for the musculoskeletal issue.
Mm-hmm.
So they are also have a link. They also have a link surely with the squamous. They have squamous gastric disease, but with
Right.
the glandular, it needs to be understood how much they have involved with it. So this needs to be more studied and
Right.
experimental stages.
Right.
That's why you will find the limited information about it. But we have seen the cases with both, with only singular and all with the both composite disease. That is EGUS.
Right. Right. Now, what are the emerging therapies for this? Like you mentioned, the grass mat, which is a practical solution, which is a
Yes.
very practical solution. What are
Management.
other elements that can be deployed by trainers or owners?
Yes. See, if we see to this whole nutshell of this treatment protocols, we need suppression of the gastric acid that is
Hmm.
indicated in the management of both equine squamous gastric disease as
Hmm.
well as equine glandular gastric disease.
Makes sense.
We have a one drug which is approved, only one drug approved by United States Food and Drug Administration, that is omeprazole.
Yes. Okay.
Omeprazole, different names coming, but the
Yeah.
active ingredient is omeprazole. And it's giving daily, orally, we give 1 to 2 hours before the feed, ideally, and then we start feeding the horses. So what
Hmm.
it is a proton pump inhibitor that irreversibly
Hmm.
impairs the pump that secretes the acid,
Hmm.
and it in turn forms the new pumps for the acid production.
Hmm.
It has been scientifically proven also that if we do the if we treat the equine squamous gastric disease with omeprazole, as per the dose rate of 4 mg per kg body weight, in 28 to 35 days,
Hmm.
we will get the good healing effects, like around
Right.
70 to 75% of the
Okay.
horses like this. But if not, but the best ideal practice is we scope the horse.
Right.
When we do 1 month, and then we scope,
Yeah.
and then we do the further treatment
Right.
along with the management. That is, we are adding gastric supplements to the horse, which
Right.
buffer the acid,
Yeah.
and the treatment does its own program,
Hmm.
along with the management of the feeding.
Right.
And then the training protocols also. It is a
Hmm.
complex, it is a cycle which
Mm.
needs to be continued by all, then we will have the results. Regarding the glandular ulceration, it can be
Sir,
sometimes
here I will just interrupt you. The question I had was, does it differ from horse to horse? So, like you, as a, when you go to a stable, they might have 20 horses, they might have 200 horses. Does it differ? This treatment protocol that you were talking about, does it differ, or would you be able to give everybody has this particular disease should be
okay, okay.
considered, or is that
In every stable, almost, there are the categories of the horses: high performers, mediocres, newcomers, and the retired ones. The more
Right.
suspicious horses, which the concerned trainer or the stable manager know. More suspicious will be the high performers who have the history of older ulceration problems. The
Right.
owner has to target them first because
Right.
equine gastric ulcers are caused by a cycle of stress and other risk factors.
Right.
So he knows these are suspicious horses. These are the
Mm.
high performers. And instead of scoping, because the finance, the capital is very important part
Mm.
of this. The
Mm.
60% of if you see the farm budget goes with the nutrition,
Mm. Mm.
almost
Yes.
50%.
Yes.
60%. So they have to manage, keeping the management of the budget in view. We do
Mm.
first the suspicious one, high
Right.
performers,
Right.
and other having the health anomalies,
Right.
which are more towards the GIT track.
Right.
So we need to start the treatment protocol. But the first best gold standard will be to scope the horse so that we know the level of ulceration. Is it
Yeah.
only squamous or it's glandular or it's
Okay.
both?
Okay.
So so the program has to be like this, and then the treatment program, how the
Mm.
medication is be given, when it should be given, and for how long it should be given, along with
Right.
the management. Management in terms of the supplement, buffer
Mm-hmm.
supplements, or the
Mm-hmm.
management in terms of the feeding. They all
Mm.
contribute to the well-being of the GIT tract of the horse.
Right.
So it's like
Right.
that. We were on the glandular ulceration where we stopped. Now
Yes.
we are
Yes.
resuming with that. Sometimes the equine this glandular gastric disease is difficult to treat. Why? Because there are factors for it, like it needs a prolonged therapy, inadequate acid suppression, and
Mm-hmm.
possibly sometimes there is, along with the gastric ulceration, there is a secondary bacterial infection. So
Right.
we need to treat it with a typical treatment protocol. So what in this we need? We give him omeprazole, and we also at separate times, around 2 to 3 hours gap, we manage it giving the mucosal protectants. If you
Right.
remember during our interview, we were telling there is something which is breaking the mechanism of the wall. It's
Yes.
already there.
Yeah.
But now what we are doing, we are giving the mucosal protectant, that is sacralpic and misoprostol. It's both
Mm-hmm.
used in the horse.
Mm-hmm.
And the minimum therapy, in my opinion, should go from 8 to 10 weeks. And every month you should scope the horse
Yeah.
so that you know how the healing is going on. Do we
Yeah.
need to add anything more, or we need to reduce, or
Mm.
we need to make owner aware? Because
Right.
owner awareness is important.
Right.
Every equine passionate owner, rider, or stable manager, or any athlete, he has to understand the horse, what
Mm.
he exactly has to do besides taking him for any sports.
Absolutely.
So it works like that. It's a full cycle, and everybody in equestrian has to be
Mm.
part of it.
Right. Makes perfect sense. Um, Now, if we look at the if you look at the risk benefit balance, what are the preventive strategies that we can you can recommend, especially when you're already treating them for musculoskeletal issues? So preventive strategy, I don't know if preventive is possible, but what could be sort of preventive for performance horses? Good habits to start from beginning.
Like, can you repeat this question? This is related to the like NSAID usage, you mean,
Yeah,
and
if they are
non-steroidal
already on
drugs?
NSID, yeah, if they're already on that, and if you want to, so they're very susceptible to gastric ulcers, then is there anything preventive to, to help them, or at least if they have a little bit of ulcer, then to prevent it from uh, getting into a full-blown attack? How do you keep it, reduce it, prevent it? Is there
Yeah.
something called prevention?
Yes. There is prevention. See, now there are two prevention modes in it. One is you do a medicinal prevention, like in the omeprazole drug, there is written preventive and therapeutic dose. The
Uh-huh.
preventive is you have to give a lower dose for a certain period of time. This is prevention. Again, this is for the suspicious authors, high
Yeah,
performers, prone to the GIT now.
right.
Then comes the other preventive measures like giving the buffer supplements. Like we
Yes,
have the bicarbonates, we, we have the bicarbonates, we have probiotics, prebiotics, we have
right.
amino acids like glycine and glutamine. Then we have yeast, and then we
Mm.
have slippery, ill bark. We have pectin and lecithin. These are all the factors. What they do, they are anti-inflammatory. Aloe vera,
Mm,
you take it, simple one. It's an anti-inflammatory. It has a soothing effect. You take pectin and lecithin. It has the mucilage effect. It
mm,
provides the mucus lining so that the
right,
acid does not erode the wall of the stomach. So
right.
there is the protocol,
Mm-hmm.
pre-treatment protocol, preventive treatment protocol, which we need to follow as in the
Right,
equestrian. So
right.
it will start with, for example, you have one horse, there is no ulceration in it, and we know he's in high performance, he's in competing horse, or he's running in a schoolmaster as a riding school.
Mm-hmm.
So we will manage his feeding program. How we'll manage his feeding program? We will not feed grain first. We will feed first hay. Hay,
Right,
feed. Hay, feed. Like this. It should
right,
be a cycle. So
right.
feeding on empty stomach, direct grain, right, will reduce the pH. And
Ah,
again also. So
right.
this has to be done. Then second, buffer supplement. We have common buffer supplements like we call them anti-acid supplements like
Mm,
aluminum hydroxide, magnesium hydroxide, and others. But they
mm,
need to be used under veterinary supervision.
right, right, right.
They can have adverse effects also. Along with the supplements like with prebiotics, probiotics, we already have in the
Right,
equestrian sophisticated feeds. Nowadays, every feed has prebiotic and probiotic, almost a
right.
good branded feed. Then you have licorin extract. Then we have some amino acids that contribute to the healing, like if there is some erosion going on. And there are some like we will come to the more details like subtle signs,
Yes,
acute signs. So what we can do, we can add these things, like I told
right,
you, yeast, or we
right.
can add pectin and lecithin. Already the supplements are there with different
Mm,
brand names for the gastric anomalies. If owner uses them, yes, he will
mm,
not come to the terminal stage along with the management practice.
fine.
Management is two. One is feeding management and exercise management.
Right,
Paddock
right,
turnover, like I told you, the man-made factors, we need to
right,
reduce them to the minimum stage.
right,
Then the
right.
preventive will work. That's why the drug manufacturers are writing two, preventive and therapeutic. There is written
Makes
in there.
sense. Yeah, yeah.
Yeah. But when you see something, the signs of
Uh-huh.
gastric ulceration, then you need to start with the therapeutic
Right,
because
right,
otherwise it will you can increase the grade of ulceration in the horses
right.
because we don't know what's inside. So either we need to scope or start the treatment. The thing is that the UAE leadership plays a very significant role in the
Uh-huh.
elevation of equestrian sports globally.
Right.
This is because their deep-rooted passion for the horses, continued with the strategic vision,
Uh-huh.
has helped all the equestrian community in UAE and the worldwide to shape the future of horse racing,
Makes sense.
being it in endurance or show jumping worldwide. They have a
Mm,
strategic approach to the equestrian.
right.
That's why in UAE you will see from October till
Mm,
March, April, you will see the equestrian events running back to back. You will see
correct.
national, you will see training show, you will
Yeah.
see FEI shows.
Thank you so much, sir. Thank you very, very much. It was an absolute pleasure to have you and to
In a
get your
brief, we can.
opinion on
Yeah.
these things.
Yes.